So my typical workflow will be patient comes into the hallway. I'll go ahead, I'll just kind of demonstrate on the sign and submit, we'll say. Okay, so they'll show up on the tracking screen as a new patient. They'll have a caduceus saying they haven't been seen yet. So I'll right click and assign provider. Typically then what I'll do is I'll go ahead and open that chart and see whether or not they've been there before. And in my documentation tab, I have a filter for discharge summaries. What I'll do is I'll bring up the last discharge summary on the patient, pick up my microphone and say, this is a 46-year-old male with a history of, and then go ahead and list all of the things that the patient has. And then go ahead and start the note. And it's hard to demonstrate in this, but basically you can dictate that while you're looking at the discharge summaries. And then it sits in that box, in that dragon box. Then what I'll do is I'll open a new note. I'll give the adult chart command, and then the cursor ends up in the HPI, and then I'll just blow that in. Then I'll go and see the patient in the hallway with the paramedics or with the nursing note or what have you. And it's funny because the paramedics will give me report and they'll tell me stuff that I already know. In fact, sometimes they'll say, I think he was here last week with something, and I'll say, yes, right lower lobe pneumonia. You know, it was a staph pneumonia or what have you. Anyway, then I'll come back and I'll complete my HPI. I'll dictate in the key elements of history that I obtained, anything that's pertinent in the ROS, and then do my physical exam. So within 3 or 4 minutes, I'll have that done. I'll typically go over to orders, and actually the way I'm doing orders now is the way that they recommend it, and that's in the EDView quick orders. More recently, I've changed from add order process to the quick order process. Do you have many providers that have used Cerner previously?
There's a good number of them that have.
And what they'll typically do, and for orders, do whatever they're comfortable with. If they've done add order in the past, then that's fine. Add orders works great. Quick orders is a little bit quicker. There it is. Okay. So typically for, let's say it's a cardiac patient, saving log cardiac monitor, oxygen, EKG, that may have been ordered by nursing. They might get aspirin orally. They might get some morphine. I have pre-saved. These are all my pre-saved favorites that we're going to recommend that you guys get set up in advance. In fact, we'll talk about that in a second. We'll do a UA, CBC basic, troponin, BNP, blood culture, COVID swab, of course, and chest x-ray for shortness of breath. Orders for signature. They're all saved favorites with reason for exam and all the appropriate orders. Since I've saved ones that I use all the time, I don't have to modify them. Then I go back to documentation. I'll refresh the orders section. Oh, this doesn't work. Oh, did I sign them? Yeah, I did sign them. Okay, I guess because this is a test environment and those orders can't be placed. Let me go to orders and plans. Oh, interesting. Interesting. And then EDView, yeah, I had signed them. Okay, so it doesn't show what happens. Typical workflow though, I'll go to documentation, I'll go ahead and refresh, I'll see all my orders, and then I'll save the chart. Oh, the EKG was done before them coming in, so I'll quick dictate an EKG, and then I'll save and close. And I'll call it chest pain, and or just leave ED note if I don't know the reason, or I don't know the exact reason at the time why they're there. And then I can always change the name of the note at the very end of the encounter when I sign it. Anyway, okay that, and I'm done. So what I've done in the span of 3 to 5 minutes is assign myself to the patient, look at the past history, dictate a note, go see the patient or at least start the note. And you could do it in different orders, but basically seen the patient, put all the orders I want in, started my history and physical, and then save the note. And then basically I'm done until all the labs and radiology are back. I'll blow those in and then come to the, if I need to admit the patient or what have you, then go ahead and go through that process. So everybody has a different workflow that works for them. We just teach them the mechanics of how to do the individual pieces, but the big picture they put together, usually after, based on what their prior workflow has been, or after they've had a chance to kind of try out different processes.